Hi, in this video, I'll be talking about breast cancer in younger women. And in general, when we talk about younger women, we're talking about women under 40 or under 30. Breast cancer is quite rare in such young women, but if you're watching this, it's probably the case that you were diagnosed at a younger age or someone in your life was diagnosed at a younger age. In general, the treatment is the same for younger women as it is for women who are older, except that some of our treatment decisions depend on whether or not people have functioning ovaries, and younger women tend to have functioning ovaries. So I'll mention a couple treatment things that relate to treatment specifically in younger women. So because in tumors that are estrogen receptor positive, we recommend ovarian suppression, where we suppress the ovaries with injections or with surgery. It's important to know that might be part of your treatment plan if, again, the tumor is estrogen and or progesterone receptor positive, regardless of the HER2 status. That's in people where we are recommending chemotherapy. So that's not the same case in ductal carcinoma in situ. That's not the case in somebody whose tumor was estrogen receptor negative. We don't recommend ovarian function suppression. A couple other things come up that are really important. One is that if you are still in your childbearing years, it's important that you talk with your doctor about your desires for having more children. If you do not want more children, you want to let your doctor know that. Even more important, if you would like to try to preserve your fertility and have more children after breast cancer and its treatment, you want to let your medical team know this as soon as possible. There are a lot of things that we can do to reduce the chances of you losing your fertility. There are things we can do during treatment, and even more important, there are things we can do before you go into treatment in terms of harvesting your eggs for later fertilization. And we have learned so much about how to do this. And the delay to do that is generally considered very safe in the vast majority of people. But if you go through surgery and you're just about to start chemotherapy and then you remember, oh, I want to talk about preserving my fertility, now it's delaying things, often to the point where we don't want to delay it. I don't mean to scare you if you're just about to start chemotherapy. Most of the time, it's okay to take a pause, a timeout, and try to harvest the ova. And the procedure is done at a subspecialty clinic, and I would recommend that you identify a place where they're used to. They specialize in something called oncofertility, or fertility related to cancer care. So ask early, ask often, keep asking questions till you get to the right person. If you're closer to 40, it's harder for us to conceive the older we get. Actually, even after 35 doesn't mean it's not possible. It's just a little less successful. There can be some grieving around this that I just want to mention. If you have a child and you were planning on a second child, there's a lot of loss with loss of fertility. It's one more loss, isn't it? Not just losing your hair and your sense of health and all the roles that you play in your life, but the grief over a dream not fulfilled. So just be extra kind to yourself if you have lost fertility due to cancer and its treatments, or it's felt not to be safe to wait, which again is usually not the case, but that could arise. The other thing to know about cancer in younger women is that we don't recommend mammography screening in very young people because the breast tissue is much more vulnerable to the radiation effects of mammograms. So although they're very safe in people who need them regularly, or in people over 40, and people under 30 in particular, we don't recommend mammograms because think about getting a mammogram every year in breast tissue that's quite vulnerable to radiation. We may actually increase the risk of breast cancer. There are exceptions. People who have an inherited susceptibility to breast cancer, we do imaging because the benefits outweigh the risks. So that's a different situation. But because even, let's just take an average risk woman where we didn't know that she had a cancer and she's not getting screening, that can be a contributor to why cancers are more advanced. But even more important to know is the fact that the biology or the behavior or personality, if you will, of breast cancer in younger women is such that mammograms often don't pick it up. So we do annual mammograms, and your cancer, if it's more active, you get your mammogram in February, let's say, and the tumor becomes detectable a few months later. And by the time you get your mammogram next February, it's actually grown enough that it's not really a small tumor, which is what we're hoping mammograms will pick up. So mammography in younger women, not recommended because of the excessive exposure to radiation, because it's not as effective. The tumors are just the type where they're not the slow growing tumors, they grow more actively. The other thing is that younger women, when they go to the doctors with a breast abnormality, are often told, because breast cancer is rare in younger women, that it's most likely a cyst or it's most likely not anything to worry about. If the if the abnormality changes with your cycles, that's probably the case. But if it persists or if it changes in any way, it's good to get that looked at. You just need to keep seeking answers and get imaging, whether it's an ultrasound or a mammogram or an MRI. You want to pursue a breast abnormality that persists and doesn't fluctuate with your cycles and on exam doesn't feel like fibrocystic disease. Fibrocystic disease feels like little ropes, like little continuous ropes. A solid mass is different. So I've covered a lot already. And then, special considerations under treatment that we do recommend ovarian function suppression, that you want to think about fertility, that breast cancers in women are a little more biologically active. They divide more quickly, so mammograms don't work as well. The interesting thing is that breast cancer treated appropriately in younger women does not have a worse outcome. So it's not associated with a poorer prognosis if correct treatment is given. One thing that could happen is people could be undertreated because people want to keep their fertility of their patients and not realize that they can actually preserve fertility in other ways. I've covered a lot here. I hope it's been helpful. If you want to learn more about your particular treatment options, visit yerbba.com for your personalized report. If this video is helpful, you can click like and subscribe. That helps you find other videos like this and other people like you find videos like this. You can drop a comment or a question if you have one, and we'll try to get back to you within the next week or so. And follow us on Instagram as well. Thanks for watching.